Hello and greetings from the Cocoon Moon Room. It's your girl Pam. Happy Sunday. Hope all is going well. Everyone had a great weekend. 2019 is off to a busy, ferocious start. So I just want to jump right into this. I am going to, due to the fact that I'm getting hit with so many messages, so many people living in fear with regard to their health, not knowing which direction to turn when situations arise, particularly pain, prolonging surgery, and whatnot. I just had surgery in November, a total knee replacement, which I'll be doing a blog on very soon. New Knee November, we're going to call it. So, but I just want to jump right into the top 10 essentials of what I feel that helped me and I feel may be able to be of a benefit to someone. So here I go, jumping right in. So these were the essentials to assist me in my recovery. So the first one is number one, you will need the help and support of someone who truly knows you and is willing to be patient with you with your requests. Let me tell you, you don't know what you need until you need it sometimes. And you'll find yourself in that situation when you are up for knee replacement or hip or whatever type of replacement. And then when you do get that person to assist, you want to be patient, kind, and understanding when others come to your aid. Of course, you're in pain, you're frustrated, it's not fun. But, you know, when you send somebody to the store, they come back with the wrong thing. Hey, make it work. Number two, you want to wear comfortable, loose-fitting clothing around the house. This ensures comfortability for getting up and down, in-house nursing and therapy visits, if you have those. I did. Number three, listen to and comply with your physicians and therapists' orders. So they will print those out for you. They will email them to you in some cases. So you always want to refer to those because those are a good tool and resource and guide. Number four, you want to make sure your home is convenient and everything around you is accessible. I'm talking about your remotes, your devices, your chargers, headphones, medications, bottled water, notebooks, pens, chapstick, wipes, snacks, blankets, books, magazines, pillows to elevate your legs, all of that. And you also will want to set your devices to alarm you to remind you when it's time to take your medication because you don't want to let your pain creep up on you. You want to stay on top of it. And these are my experiences, my thoughts, my opinions, my beliefs. Also, make sure that your devices or your calendar is set up to let you know when your visits are happening, when the therapist is going to show up, that kind of thing. Because you want to make sure if you can't get to the door that someone is there to make sure they can get in. Let's see, and make sure your walking path is clear. So make sure there's no cords, wires, kids' toys, pets' toys, shoes. You don't want a chance of fall in your recovery. Number five, know when to hold them and when it's time to fold them. Now by this I mean when your body tells you to rest, ice, and elevate your leg, listen. You can always catch up on things through Facebook, phone calls. There's always going to be time to get updates. Somebody will put you up on it. Number six, don't be ashamed or embarrassed to lose some of your independence. You may need to rely on others to help you with your meal planning, chores, errands. Be prepared to have someone lined up who's willing to be there, often at a short notice. Number seven, pre-stock and shop for your favorite items, whether snacks, household sanitary items, for a few weeks. You'll be glad you did so, trust me. Number eight, do utilize and implement the therapist's tips and processes to make tasks more ergonomic for you. And this will help reduce an injury. I mean, my therapist, they even showed me how to use my bathrobe belt as to help me pull my knee up and down, back and forth. So just little things like that, just to help you get your exercises in and that kind of stuff. Number 9, garner an accountability partner. You want to have someone lined up to send you a text, checking on you, making sure that you're using your incentive spirometer, your breathing machine, because you don't want to catch pneumonia. Making sure you're following doctor's orders. And of course, you want to be honest with them because they genuinely care. That's why they're checking up on you. Number 10, and these were in no particular order, but this is what I made number 10. Preoperatively, exercise and strengthen your upper and lower body. Simple tasks like getting up and down, pushing yourself off the bed, they'll all be compromised after surgery. So do the pre-work. So build that core, and get yourself, strong so you can have a great, awesome recovery. So I didn't make this too long. I just had a top 10. If anyone has anything to add, that's fine. If you have any questions, message me. I'll put my email below. Inbox me. Have a wonderful day, everybody.